Story sounds fake but is 100% true. A 28-year-old Russian man named Artyom Sidorkin started having severe chest pains. And at first he tried to ignore it, but it got so bad he could barely stand up, and then he began coughing up blood. And so finally he went to the emergency room. When he got there, even before the doctors examined him or gave him an X-ray, just based on the way he presented to them, being pale in the face and hunched over and very sick looking, they assumed this must be something very serious. So that day they brought Mr. Sidorkin in for an examination, and after talking to him and hearing about all of his symptoms and just looking at him, the assumption was he probably has a tumor in his lungs. And so they sent him in for an X-ray, and afterwards the radiologist looked at the X-ray and confirmed that there was a mass growing inside of his lungs. And so before they went to just start removing huge pieces of his lung, they told him that they would like to do a biopsy where they remove a small piece of the tissue and test it to see if it's cancerous or not. And so Mr. Sidorkin is terrified, but he says, okay, and schedules his surgery. He goes in a couple of days later and the surgeon pulls out a piece of his lung tissue. And as it's sitting on the tray, he looks down at the tissue. The surgeon realizes there is something hidden inside of the tissue, as if the tissue was like an envelope holding something inside of it. And so he opens